Hello, my name's Mark Wolgan. I'm an orthopedic surgeon in practice in Albany, Georgia. Very often people ask me about heel pain, and so I made this presentation into a little video to try to outline some of my thoughts. The condition that you often hear about is called plantar fasciitis, which I'll outline here. We're talking about pain on the sole of the heel, not on the back where the Achilles goes in, but people describe their symptoms like a stone bruise. There may be pain or tingling and numbness on the sole. The word plantar refers to the sole of the heel, just like the word palmar refers to the palm of our hand. The fascia is the thick connective tissue that we see on the sole of our heel if we took off the skin and fat. Now this fascia functions kind of like the string on the bow for a bow and arrow to help support our arch. What happens is somewhere along the line, and you don't have to remember having a trauma or anything that you can recall, there develops a tear in this tissue. And the tissue is focused on the heel and it fans out in the toes. The heel gets the concentration, so it's more likely to get a tear in there. And the tear is seen by our body as injury. So the process of healing the injury is what causes what is referred to as inflammation. And the suffix on words itis refers to the inflammatory process like dermatitis or appendicitis. The issue in understanding this condition deals with understanding elasticity of tissues. Now, any material has a certain elastic property. Like a stick in the forest, you might find one that's fresh off the tree and it's very flexible, and an old one that might have been dried out will be very brittle. So what happens with our plantar fascia, as we get older, it gets less flexible. The stiffer the tissues are, the more likely they are to crack, and the more flexible they are, the less likely they are to crack or tear. We can illustrate this issue looking at a rubber band. We've all been familiar with how a rubber band can stretch, but a rubber band that gets dried out a little bit might have cracks in it, and those cracks are seen by our body as injury. The tear can stay torn while we walk around all day, and it won't get to catch up on the healing unless we rest. Now, unfortunately, nobody rests like this. It's only unfortunate for this condition, but the position like that would keep the plantar fascia stretched, but instead everybody rests with their toe down because there's more muscle tone in the calf than in the front muscles. And so in that position, the plantar fascia is actually a bit shortened. So if it heals in that position, then you put your foot on the floor in the morning or after getting up for a period of seated position, and you re-tear that plantar fascia, and it never really gets a chance to heal. So we have to look at what our strategies are, and I'm going to outline what my treatment strategies are. We really focus on stretching, medications, and use of a night splint. The stretching program is designed to make the tissues more flexible and to allow some healing to occur. And I'm going to have several slides to show how to do the stretching because it's important, especially if you wind up doing it wrong, you're wasting the time. The way the stretching is done is illustrated here, and the important points are that the heel stays on the ground, the leg that's being stretched is farther from the wall, the knee stays straight, the back knee stays straight, the front knee is bent. As you get more flexible, you can have your heel come farther from the wall. The toes point towards the wall, because if the toes are rotated out, then you're not really stretching the calf and the plantar fascia. You keep a sustained stretch, you count to 10, and you don't bounce. And you do it for 5 or 6 times a day for about a minute at a time. So we're really only asking for 5 or 6 minutes out of your day to help make your pain better. Now it seems like why would you stretch the Achilles, but the Achilles is connected to the plantar fascia and the force is transmitted through there. So even though you'll feel more stretch in your calf, you're really stretching both. When you get up in the morning or you get up for after a period of being seated, if you lift up your toes and stretch your ankle up and massage the heel, that also helps make those first few steps better. Anti-inflammatory medications are another way that can help your pain be better. I've never seen anyone be cured by taking these medicines, but it does help take the edge off. And I think a really important thing is use of a night splint, because by keeping the foot at a 90-degree angle to the leg, it allows that plantar fascia to heal in a stretched position. And then it winds up not tearing when you put your foot on the floor. And it takes 4 to 6 weeks for that to work. Some people talk about other treatments like rolling your foot over a Coke bottle or a tennis ball. That may help you feel better for a while, but I don't think it gives long-term relief. Injections are another issue that are often discussed. The body has inflammation trying to heal an injury, and then you inject cortisone, which calms down the inflammation. but it doesn't really make the healing occur. Plus, the fat pad of the heel can become atrophic or thinned, so I'm not a big fan of injections. And surgery is only used for certain cases, and most people get better without operating. In summary, the treatment for this condition focuses on stretching your plantar fascia so that your tissues become more flexible, and in most cases the prognosis is good, although it takes quite some time for this to feel better. And that's basically it. Hopefully this little presentation helped you, and feel free to check with us if you have any more questions. Thanks.